Okay. Now, for chapter 15, this is alterations in blood flow. So what happens here, the beginning of this chapter, which were the slides that I'm omitting, goes over basic anatomy, as you see. Just the basic anatomy of vessels, and also blood flow. Okay, flow, pressure, resistance, which you guys should have got this information in physiology. Okay, so we all know about how blood pressure flows from high to low and all that, and everybody's good with that. Okay, so we're going to leave all that out in the dynamics of microcirculation and fluid and pressure, and we're going to get right into, what's the slide? 27. Okay. So we're going to get right into the alterations. Okay. What can alter flow? Okay, so we'll get right into that.
Page?
I'm on slide 27.
Page 9 for you.
Okay. So, reduction in flow will impair the ability to transport gases and nutrients to the body, okay, which we all know. So if we have an alteration in blood flow, blood is not flowing as it should. And we know blood carries not only just blood products, but it also carries gases, nutrients, and things that have to get to different organs and tissues, okay? So therefore, if an organ is lacking any type of blood flow, it will definitely get into a state of either hypoxia or ischemia. Now let me go over these terms with you just to confirm the correct definition. So hypoxia is going to be a decrease in oxygen supply. Okay, hypoxia will be a decrease in oxygen supply. Ischemia is going to be a decrease in blood supply to tissues. Ischemia is going to be a decrease in blood supply to tissues. And then venous engorgement is going to be an increased amount of blood in an organ that can lead to congestion. Yes, ischemia is going to be a decrease in blood supply to tissues. And venous engorgement is going to be an increased amount of blood in an organ that leads to congestion. Okay, congestion, or sometimes they would also say venous stasis type situation, where the vein is just now engorged and filled with blood. Okay. And venous obstruction, obviously this is going to be some sort of obstruction in venous flow. That will therefore cause not so much an ischemia, but what happens when there's an obstruction with venous flow, it actually leads to an edema. Okay. Now, let's go over some more terms here with obstruction. We have two terms here, downstream and upstream. Okay, so what does this mean? Obstruction that results in reduced flow beyond the obstruction is going to be what is considered on the downstream, okay, which means that we reduce the flow beyond the point of obstruction. Anytime we increase pressure above the obstruction, this is on the upstream, okay, so whatever's going on the upstream is the difference than the downstream. Did I just confuse you? Sorry. Okay, so the downstream, again, reduced flow beyond the obstruction, whereas there will be increased pressure above the obstruction, which will result in what is termed as the upstream. Okay, the upstream has pressure. Now, arterial system obstruction manifests as distal ischemia, whereas venous will manifest as edema. Okay, so let's understand that. Why? If we have arterial blood, we know that arterial blood, this blood flow goes to where? Not just the heart, but the body. Okay, so everywhere in the body, all organs and tissues gets this nice, rich, oxygenated blood. Okay, and now we'll take that in. If we lack that nice, rich, oxygenated blood getting to organs and tissues, it will lead to what is called an ischemia at the tissue level. Okay, which we went over, I think, this term before. Now, venous system is different. Now, what's the difference with the venous system?
Blood, deoxygenated blood back to the heart.
It takes blood, deoxygenated blood back to the heart, which means it's now taking that poor oxygen-rich, or decreased oxygen, or less oxygenated blood back to the heart, which is now at a slower pace, okay, than arterial pressure. And so what happens here, if there's an obstruction with venous flow, what will happen here, because of the rate of pressure it is, it will now cause an edema, okay, as opposed to an ischemia, because it's not going to tissues, but it's actually going back into circulation to get to the heart. Okay, is everybody with me with that? Now, thrombus. When we talk about a thrombus, most of you guys already know what this is. So what's a thrombus as far as your common knowledge of a thrombus? Clot, okay? And what about that clot? Is it stationary? Is it moving? Okay? This is a stationary blood clot. Okay, so please understand that a thrombus is a stationary blood clot that can be formed either in a vessel, and sometimes they can also use this term if there's a thrombus in the heart. Okay? Excuse me. Again, arterial thrombus will result in ischemia, as opposed to venous will be in an edema or result in an edema situation. They can give these patients anticoagulant therapy, okay, or drugs to block the platelet aggregation to kind of stop this progression of the thrombus, okay. Now keep in mind, what are some things that you know that can form a thrombus? Just some things that you think could form a thrombus formation in a blood vessel. I'm looking for elements.
Lipids.
Lipids, very good. And what else? Lipids and lipids. Lipids. Okay. Lipids and something we just went over. Before fibrin, platelets. Very good. Platelets. Okay. So platelets can aggregate, okay, if we have too much, like a thrombocytosis situation, where they can now form a clot. Or sometimes if we have individuals that do have high amounts of lipids, and we'll go over, I think next week, I'm going to walk you through the whole pathogenesis of atherosclerosis, okay, and how the lipids form and the plaque and all that, okay. So yes, lipids can form that sort of plaquing situation, which can form into a big thrombosis. Okay, so very good. Now, once we have a thrombus, keep in mind that sometimes this thrombus can break off and travel. When it breaks off and travel, we do call this now an emboli. Okay. Keep in mind that if we have an embolus that is leaving the left ventricle, it can cause ischemic stroke. Why? Because we know the left side of the heart takes blood everywhere in the body, okay, with the exception of the lungs. So therefore, it will cause an ischemic stroke. Whereas if we have an embolus leaving the right ventricle, which we know blood, okay, leaving the right ventricle goes to the lungs, this will now be what is called a pulmonary embolism. Okay, is everybody with me? Okay, so treatment here again, anticoagulant therapy. They can also do different types of therapy to remove the emboli if possible, or some sort of filters to kind of pull it out, okay, or filter the blood. Now, a couple of different things we have to go over. Okay. Vasospasm. Sometimes even if you don't have, say, a particular clotting situation or platelets are pooling up or what have you, sometimes the vessel can just kind of get a little goofy. Okay, use that term goofy, but sometimes the vessel can actually go into a state of spasm, okay, where it will spasm, go into a state of spasm, and now obviously reduce the lumen space and now reduce blood flow. This can happen sometimes depending on different hormonal changes or different environmental factors. Different things can now cause this. A very good example, and I think I talked about this, I'm not sure, mixing classes. But when I talked about before with angina, okay, did I talk to you guys about angina? No. Okay. I think so. Maybe the first day. Okay. So keep in mind that when we have angina, chest pain, okay, so say for example, a patient has a vasospasm of the coronary artery. That doesn't mean that they're having a heart attack at that moment, but what will happen is just because the lumen of that coronary artery is now in spasm and it's occluded, it will reduce blood flow to the heart muscle itself. Heart muscle will now start to go into a state of ischemia, so to speak, And this will now lead to this person having this type of sign as chest pain, okay, angina. So this is what happens just from a vasospasm. Another good example is headaches. Headaches are definitely vascular. Sometimes, yes, they do have a hormonal component to it, sometimes a neural component, depending on what's going on. But headaches definitely have a vascular component, and so what happens sometimes, patients don't know how to take care of that vascular component. How do you reduce the spasm, okay, and relieve that headache? One way that I was taught in school is, I know this sounds weird, but to put a cold pack on your forehead and put a hot pack around your neck. And the combination of the heat and cold actually relaxes the vessel just at a right moment to release and let the blood flow through, and it actually calms down the headache. So that's just an alternative treatment. But they do have other treatments, as you know, for migraines and things that will actually open up the vessel, okay, and let the blood flow through. As you know, most of these seizure medications, I believe, I can't remember the ones off the top of my head, but some of them are used to treat migraines, okay, to actually reduce that vasospasm and get the blood flowing. And if you ever had a migraine, you know what that feels like, and it's very debilitating. And again, mainly, most of that is vascular. Now, inflammation. Sometimes the vessel itself can go through an inflammatory process. So just like the vasospasm, it can go into a state of inflammation and get these inflammatory mediators and go through all of that inflammatory process inside the vessel, which will now make the vessel sort of occluded. Okay, so if you have a lot of chemical mediators and blood cells and all the signs of inflammation that makes it goes into spasm and constriction and so forth, this will obviously cause a lot of issues. So we do have some different terms for this. And just to let you know, these itises can put a person, or sometimes, I don't want to say predispose them, they say risk, but sometimes it can also precede a thrombus, okay? And this kind of thing sort of happened to me. I was diagnosed with thrombophlebitis, which was from a complication of a thrombus that I had in my leg, okay? So what will happen here is that the vessel can go through a state of an itis, inflammation, and then all of a sudden the blood will get stagnant and everything will just pool up and cause the actual thrombus. Okay, so that can precede a thrombus. So vasculitis is an inflammation of the intima of the artery. Phlebitis is in the vein. Okay, and arteritis is going to be an inflammatory process, autoimmune origin in the arteries. Okay, so sometimes an autoimmune process, not knowing what it is, okay, can cause that. Yes? Oh, the intima of the, I should remember the intima. Okay, the intima is the lining of the artery. That's the inside of the artery. Okay. So if we go back to the beginning of the PowerPoint, they go over the anatomy, okay, of the artery. Okay, now, compression. As we know, sometimes different compressions, okay, on vessels can also cause issues. Just to kind of quickly go through this, they can cause a partial or complete obstruction. So obviously any type of crush injury, trauma, tight cast or dressing. So sometimes people that may have, I would say, well, they said cast there, but even like sometimes when people have certain tourniquets and things just kind of too tight, okay, around a limb, that can also cause different types of compression injuries too. Now, a couple of things here. We're going to talk about arterial sclerosis and atherosclerosis, aneurysms, and fistulas. Okay. I wish I had a board. Okay.
We're going to steal one.
I know, I gotta get one. Okay, do you guys know the difference between, and I know I went over this with you guys, whoever had it for Fizz. Do you guys know the difference between arterial sclerosis and atherosclerosis? What is the difference? One is in, they're in two different locations. Yes.
One is in arterial, the other one is in the artery.
Okay, very good. So keep in mind, arteriosclerosis is the term that is in the arteries. This is a sclerotic plaque. Oh, I can't even talk. a sclerotic plaque that actually happens in the artery, okay, the large artery. Whereas arteriosclerosis is the sclerotic plaque that can happen in arterial. Okay, arterioles, if you remember from anatomy, is a smaller artery. So atherosclerosis is artery, is plaquing in the artery. Arteriosclerosis is plaquing in the arteriole. What do you remember that's important about arterioles?
They're closer to the surface?
Oh no, that was the
Not closer to the surface so much, but they're closer to capillaries. If that helps you.
There's an exchange.
There's an exchange, but it helps regulate something important in the body. You're kinda on the right track.
Is it the
People tend to forget this. And this is a very important physiological mechanism of what we're going to do in the next chapter. They help regulate blood pressure. Remember that arterioles are variable. If you remember that from physiology, actually you should have went over that in physiology. So arterioles are variable, which means that they can sort of open and close, almost like as if they had a sphincter. And it'll open and close just enough to get the blood getting through the capillaries and dispersing it out through the rest of circulation. The point in that is that arterioles are the ones that set the pace for blood pressure. Okay, so if you want to get anything out of what I just said, arterioles are the ones that set the pace for blood pressure. Okay, and how blood pressure flows through the body. Okay, that's very important because that's part of the mechanism of blood pressure. Okay, so let me move on, and we'll talk about aneurysms and stuff later. Lymphatic vessels, not much to say about lymphatic vessels. We all know what the lymphatics do, okay, so changes in capillary pressure, and if they have increased infiltration in these tissues, it can result in edema. So at any time, as you know, the lymphatic systems are definitely there to sort of clean out and get rid of, say like a waste, but they definitely filter out any type of process that's going on in the body. And keep in mind that at any time if these vessels get pretty much clogged, okay, just like, or I don't want to say a clot, so to speak, just like any other vessel, it can cause a sort of edema situation, okay? So not so much an occlusion where you're not getting blood flow to a certain area, but it will actually cause an edema. Okay, so just make sure you understand that part. Okay, now, we will go over these in a little bit. Okay, so, excuse me. I kind of talked about this already. Okay, so arteriosclerosis and atherosclerosis, I gave you the big picture there. Keep in mind that how can a person get these types of sclerotic things in the arteries and arterioles? Definitely can be from hypertension, cardiac or renal disease. As you said, yes, the kidneys do have a part in that, so a renal disease can cause a atherosclerotic plaque. Peripheral artery disease, stroke, so anything that's going to impede blood flow can give these individuals a plaquing issue. Okay, so anytime blood flow is stagnant, it can now cause a plaquing issue. Okay. Now, we'll get to some of the good stuff. Okay, so the first sort of arterial flow disease here is something called thromboanginous obliterans, also known as Berger's disease. Okay. Please understand, even though this is, they say this is rare, okay, now, have you guys ever seen these smoking commercials where they try to scare you half to death? Okay, with the diseases? And I don't know if you've seen the one where the person's fingers look like they were burnt off. Okay, well, if you've seen that commercial, that person has severe Berger's disease. Okay, so severe that it went into such a necrotic state, okay, which made the fingers go into a nasty state of necrosis. Now that was severe. They usually catch it way before that. But in any event, what this is an inflammatory process that will actually affect the arteries and veins, and they say upper and lower extremities, but most of the times the fingers are actually more common. And it results in obstruction. So at any time you get obstruction of blood flow, as you know, the next thing that's going to happen is definitely ischemia, necrosis, all that stuff that we talked about, cellular, okay, cell death. Now, please understand, smoking is a risk factor for Berger's disease. Please make sure you know that, which one of the treatment measurements is telling these patients to stop smoking. Now, they will also give them prostaglandins as a treatment, and what the prostaglandins will do, the prostaglandins will actually sort of open up the blood vessels and increase that blood flow. Okay, and reduce that inflammation. Okay, now the next one is Raynaud syndrome. Raynaud syndrome is actually quite common. Okay, with this, I don't know if you've heard of people having this issue where they have very cold fingers, very cold feet. The extremities are extremely cold, and no matter what they do to try to warm them up, okay, it just doesn't help. Even if they're in, no matter what temperature they're in. Obviously, if they're in cold temperature, it makes it worse. Okay. So what happens here is this is an extreme vasoconstriction. So it's something wrong with these individuals where the blood vessels just go into this severe spasm, so to speak, where it will stop the blood flow going to the extremities. Okay. What happens here, and this is from a neuroregulation, they do believe some mediators are involved. But the way they treat this, they have a lot of different ways of treating this, which they don't have the, how can I say, the right treatment for it. There's a lot of different ways it can be treated. So they put here biofeedback, relaxation, calcium channel blockers, okay, which we know is going to stop that whole vasoconstriction situation. So that's a good treatment there. And then they also have the prostaglandins, okay, which will stop that inflammatory process and release and let everything flow through. I know a patient that actually had this, and she was doing an alternative treatment, believe it or not, of hyperbaric oxygen, okay? And if you've ever seen those hyperbaric oxygen tanks, the one Michael Jackson used to sleep in. But in any event, those hyperbaric oxygen chambers, what they do is they actually increase the oxygen carrying capacity in the blood. So it actually increases more red blood cells, so therefore it increases blood flow. And in her situation, it actually worked very well for her, and she was good with that. But she tried those other treatments that are listed here, and it didn't help. So that was my point of explaining, is that they don't know the right treatment for it. It just, you know, depends on the individual. Okay. So now the next thing is aneurysms. Aneurysms, okay, what is it? This is when we have a vessel and then all of a sudden the vessel wall starts to dilate, okay, and it gets very large. It weakens, okay, because it's filled with blood, okay. Now, keep in mind that we do have different types of aneurysms, and I will go over in a little bit the different types. Now, they say they are frequently found in cerebral circulation, thoracic and abdominal aorta. The cerebral circulation one is a lot where people get nervous. A lot of people get nervous about this one because this is the one, unfortunately, you do hear some stories where people have severe headaches and then all of a sudden not knowing that they had an aneurysm. Okay, so this is a situation that could happen. Okay, not to say that it's going to happen with every headache, but it could happen depending on that person's history and, you know, just their situation with their vascular status and all that. So, and even as far as treatment, it all depends on what they're going to do depending on where that aneurysm is located. So I'll give you an example. A friend of mine, her mother had aneurysm right at the Circle of Willis. Okay, so if you remember from anatomy where Circle of Willis is located, and that's not a good location. It's not good to have an aneurysm, but that's definitely not a good location to have an aneurysm. So in that situation, the doctors actually did not touch it. Okay, sometimes they will go in and do what they do to relieve these aneurysms, but they wouldn't touch it because of its location.
That's right in the center of the brain?
Yes. So keep in mind that sometimes they will not touch these certain things. Okay, so depending on the location. Now, And unfortunately with her, it's like a watch and wait thing.
Oh, no.
So it's sad that she's almost like a ticking time bomb. She's an older woman. And so what happens, they just have to watch and see, hopefully it doesn't get larger. Hopefully it doesn't dissect, you know, so it's nothing they can do about it. So, and she also gets a lot of headaches. She gets a lot of headaches with it. Now, thoracic and abdominal aorta. Now, abdominal aortic aneurysms are actually sometimes found, I don't want to say by accident, but you can see them on imaging. So sometimes if a patient has an x-ray of the lumbar spine or something like that, say a lateral, and you see this thing bulging out, okay, if it's not a baby, it is definitely an aneurysm, okay? So, and you can see it actually very large. Another way of detecting abdominal aortic aneurysms is when you guys do pelvic exams, not pelvic exams, excuse me, abdominal exams, and you are touching the abdominal cavity, and there's a certain way you hold your hands to feel to see if anything's pulsating, okay, this way, or bounding up against your fingers. If anything's bounding that forcefully up against your fingers, and it's not a baby kicking, okay, that is definitely aortic aneurysm, okay, because the abdominal aorta, as you know where it lies pretty retroperitoneal, almost kind of deep, okay, or flat in the base of the floor of the abdominal cavity. So it's not going to have anything pulsating that far out, okay, unless it's a large aneurysm. Now, dissecting aneurysms, which I'll show you in a second, this is definitely an emergency situation. So we have two different types of aneurysms. You have the true, and then you have a false, and then I'll explain dissecting. So the true aneurysms have two different types. So a saccular is when there's one side that's bulging out, whereas a fusiform is both sides. Okay, so just make sure you know the two different types of true. Now, when you have a false aneurysm, this is what happens. You have here a vessel, and then all of a sudden there's a tear in the vessel. Okay, from whatever kind of injury, something happened, the vessel's weak, whatever it is, okay? It tears. When it tears, it will start to now cause bleeding. Bleeding outside of the vessel. So if you were to see this on the imaging, they will call this like a hematoma type situation. So, and that's normal. It's normal to have bleeding in that situation, okay? So that's why they call this a false aneurysm, because it's normal to have bleeding from a break. But when you look at this vessel is a little larger, which means it's filled with blood. And not only that, you can see that it already has this sort of saccular presentation here, okay, because there's so much blood. And because the saccular presentation of this wall is now stretching out, that is weak to where it now tears the endothelium, okay, of this vessel. This is called a dissecting aneurysm. So this is filled with blood, which means once that rips, all that blood is going to spill out into whatever area it's in.
So it's tearing from like an overflow.
It's tearing from an overflow.
It makes a false lumen, so it keeps stretching all the way down.
It'll stretch, okay, and then not only that, but it can spill out, okay, that blood can spill out into the adjacent tissue, okay, and that is definitely an emergency situation. Okay. Now, oh my God, I can't believe it. Okay. So, acute arterial occlusion, okay, so an absence of arterial circulation is definitely an emergency situation. If you have no arterial blood flow, you can just imagine what's happening. Okay, so let me just go over some of the signs and symptoms here. Paleness, paresthesia, okay, so anytime we have any type of the numbness situation that's going on, and possibly, I'm saying the fingertips, wherever it could be. Paralysis, okay, if there's definitely going to be any type of muscular or neurological non-movement, so to speak. Pain. Polar is cold. That's just a term for coldness. So the limb or the extremity, whatever it's going to be cold. And pulseless. So when you feel for a pulse in that region, they're not going to have much of a pulse. Okay. Okay, so let me try to hurry. Now, veins. sometimes people can have incompetent veins. Veins, we all know from anatomy, are one-way valves. Okay, so they open up, get the blood going, close. Okay, and we never want blood going back through a valve or regurgitation, especially not venous blood. Okay, because that would be a bad situation. Now, sometimes though, veins or those valves in the veins do not close as they should, or they just kind of stay open and stay stagnant. Okay, and what happens here when the person has incompetent valves, it can come a lot of times from pressure, especially when people have venous valvular issues, okay, in the lower extremity. So pressure, prolonged standing, obesity, pregnancy, so from the weight of the belly, okay, and the weight of the abdominal cavity, just putting pressure on the lower extremity. So all of those things can cause issues with the veins and the valves, okay. This can definitely give patients edema, venous stasis, obviously, and sometimes if the stasis gets really bad, these patients can get ulcers, okay, and right at that site, wherever is the cause. Now, deep vein thrombosis can be life-threatening, and we're going to go over that in a second.
Skip all these.
No. I'm sorry, I was just trying to find out where it was. Okay, no, don't skip it. Okay, so valvular, you're ready to skip it?
Quick to skip.
Valvular incompetence, so sometimes there can be overstretching of the valves, okay, which can definitely lead to a backflow of blood, which is something we don't want. But if it does happen, this can cause the issue of varicose veins, okay? So we've all seen varicose veins. We know what they look like, not pretty, okay? And so what happens with varicose veins, these are the superficial veins that actually have an issue where the valves are now just kind of bulging. I shouldn't say bulging, but they're just overstretched, and now the venous flow is just there. Okay, so what we call venous stasis. So what happens here is that these veins will actually be black, they'll be bulging, and they'll be sort of tortuous. Okay. Now sometimes people, they do say varicose veins can be hereditary, but most of the times it comes from standing on your feet for long periods of time. Definitely, as I showed you earlier, with obesity, pregnancy. So the more weight that you put on it, especially with the lower extremities, it will cause these veins to just kind of bulge. Okay. Even as you guys going into nursing and working in hospitals and standing on your feet for long periods of time, I know people that work in hospitals that actually wear compression stockings just to make sure that they prevent themselves from getting this situation, and because it could happen. It could happen even if you don't. Women are actually a little more prone to it, especially with multiple births and pregnancies and things of that nature, along with standing on your feet for long periods of time. Okay. And that's that. I think I talked about it already. So yeah, I talked about varicose veins, dark, raised, tortuous veins. I was reading something. When a person has varicose veins, when they elevate their legs, it makes them feel better. Okay, whereas opposed to if someone has DVT, by them moving around, that makes it better. Okay, so it's a difference. Treatment here is to definitely reduce the pressure, sclerotherapy, any type of surgery. I know one of my friends, she had this, and she had I think it was the laser. She had them removed. One of them, I can't remember exactly which one it was, but one of them were very painful, and then there's another type of surgery that's not so painful. But sometimes people do get these removed, not only for cosmetic reasons, but because they can give you a lot of pain too, okay? So